Now on to matters health. The striking nurses now maintain that they will not call off their strike until all their demands are met. The Kenya National Union of Nurses Secretary General Seth Panyako, who exclusively spoke to Channel 1, said it was unrealistic to ask the medics to resume duty under unfavorable working conditions. Panyako said most of their members have been exposed to the deadly COVID-19 disease in line of duty without any compensation for those who have lost their lives from the disease. This as the country's coronavirus positivity rate remained below the 5% mark 8 days in a row after 106 people tested positive for the virus from 3,315 samples tested in the last 24 hours. Purity Museo reports.
Unlike their counterparts in the healthcare sector, including doctors and clinical officers who took to the streets but within a short time returned to work after an agreement with the government, nurses say they will boycott duty for as long as it will take until their demands are met.
The reasons why we went out should be addressed before you go back to work, because if we don't do that, we'll be going back to work, and then after 1 to 3 months, we'll also be wanting to go out again.
Kenya National Union of Nurses Secretary General Seth Panyako says he will not be cowed to call off a strike that will only expose his members to a deadly COVID-19 disease.
We expect the risk allowance for nurses to be increased by 500% to make it 19,250. That is the minimum that we can accept. It should be more than that because of reasons which I may not be able to explain right now. We also want the completion of the collective bargaining agreement. And of crucial is the issue of compensation of the families, relatives and dependents of the nurses who have succumbed to COVID-19 and other ailments and even accidents.
The nurses and clinical officers took to the streets on the 7th of December 2020 demanding better conditions, but the clinicians called off their strike on Christmas Eve after reaching an agreement with the government. The industrial action coming in the middle of a pandemic, with the country's coronavirus caseload rising to 96,908 Monday after 106 Kenyans tested positive for the disease from 3,315 samples screened. Kenya's coronavirus positivity rate has remained below 5% for 8 days in a row. In a statement released by the Minister of Health Monday, only 11 counties are affected, with Nairobi taking the lead with 87 cases, followed by Uasin Gishu with 5 cases. Kiambu recorded 3 cases, Busia, Kajiado and Mombasa 2 cases each, while Makueni, Kericho, Meru and Kilifi recorded single cases. 1 person succumbed to COVID-19 disease, while 184 recovered from the disease between Sunday and Monday, pushing the fatality and recovery cases to 1,686 and 79,257 respectively. 617 patients are currently admitted in various health facilities countrywide and 2,964 under the home-based care program. Purity Museo, Channel 1 News, Nairobi.